Good evening to one and all present here. This is Divya from Medvarsity, and I'm going to be the moderator for today's session from emergency medicine. And today we will be discussing about an emerging and exciting branch of medicine, emergency medicine. Emergency medicine gained a lot of significance in the last few years, and there are several driving factors for this. And few of in the form of lives are lost each year far outstrips supply as per WHO. Every minute, at least 4 persons get killed in a road traffic incident in India, which makes it one of the most accident-prone countries in the world. In India, every day, 5,000 people die of heart attacks and 2,500 people die of stroke or get paralyzed. Neurological emergency increasing deaths from poisoning, and these are factors. We emergency medicine resuscitation administration. He is currently an examiner of college and the emergency. One of the most fast-paced and exciting environments in the healthcare industry is the emergency. Being able to quickly or fix acute health and then sending the patient on his or her way. Being an emergency physician is an exciting, varied, and challenging job. Dr. Imran, what are your views?
Can everyone hear me? If you can hear me, can you just mark in the chat that you can hear me? If you can hear me, just confirm on the chat that you can hear me, because I can't hear everyone clearly, including the moderator. Okay, so almost everyone can hear me. Okay, so thank you for coming here. This is the webinar on emergency medicine, which is the most sought after clinical specialty as per a lot of people right now. And I would like you to ask me some questions which you can put up here so that I can answer these questions. Emergency medicine right now today is the 31st recognized specialty under the Medical Council of India. And the 3-year residency programs like DNB emergency medicine, MD emergency medicine, these are rapidly growing up. A lot of medical colleges are adopting them. Hospitals are starting the DNB programs, and the numbers will continue to increase the seats as well as the emergency patients which will come out of these programs. There are many doctors who are interested in a career of emergency medicine, but they do not want to commit themselves for a 3-year program. And these are the doctors who are likely to join the 1-year diploma in emergency medicine and the 1-year training programs which are there, including Medvarsity's 1-year diploma in emergency medicine. So I can answer a lot of questions which are related.
While we have the participants just typing in the questions, I have a few questions in my table, and I'd just walk you through that, and doctor can answer for those questions. Is that okay, doctor?
Yeah, I can see the questions.
Yeah. By the way, there's one student, Amir Asan, who has asked, is DM by Medvarsity is recognized by MCI? And we have a few more questions coming up. So
Yeah.
by that, I'll just walk you through the questions which I have in my table. First is, Dr. Imran, what are your views on a career in emergency medicine?
Emergency medicine, like I told you, is one of the newest specialties which is there. In Western countries like United States and UK, that is the #1 specialty. It's among in United States, it's among the top 4 specialties which is chosen by overseas graduates. Emergency medicine is highly sought after as a postgraduate specialty for many reasons. Because you don't have inpatients in emergency medicine. It's a very fast-paced specialty. So those who like to take care of a lot of patients who have different diverse disease conditions, they like to do emergency procedures. Those who want to save lives and see it happen instantaneously in front of them. Those who are interested in disaster management, in ambulance services, pre-hospital care, resuscitation medicine, all these things are there in emergency medicine. So a lot of people choose emergency medicine because they like the way of life which happens in the emergency room, unlike other specialties.
Okay. So the next question which I have is, what is the typical work day like for someone in this field, doctor?
Okay, this is this question is asked by a lot of people. I would answer it how a consultant would do, not as a trainee. So a consultant in emergency medicine is responsible for all the emergency patients which come into the emergency room. So on a daily basis, when a consultant in EM comes to the shift, he would ensure that he would take over all the areas of the department. The areas of the department can be ambulance control, which may be connected to a lot of private hospitals. So there will be patients in transit from another hospital, from the scene of an accident back to the main hospital's emergency room. So these patients, you would review them, connect with the paramedics, speak to them, ensure that whatever care is possible within the vehicle is delivered. Then you would take over the triage area. There will be a lot of patients waiting in triage for triaging and further assessment and treatment. So you would take over this area. Then you would take over the remaining part of the emergency, starting off with the resuscitation beds or resuscitation room, the separate areas which may be there like observation beds, trauma beds. So this is how in sequence a consultant would take over the patient care from the previous shift and review these cases, ensure that whatever is the pending investigations, what is the pending treatment for them is continued. There will be a lot of referrals which will happen to different specialists to ensure that this happens. There will be many cases where the diagnosis has not been achieved in the emergency, so further referral is not possible. So these patients will be reassessed, reviewed, investigations would be reviewed, and then a specialist consult would be called for these patients. And any emergency procedures which are required for certain patients there, you would do all this. So this is all part of the clinical territory. There will be a lot of junior doctors who are working, so giving them the feedback, ensuring that sufficient supervision is present for these doctors, ensuring bedside teaching is happening. So this is what a consultant will be doing. In addition to this, there will be a lot of administrative work related to the hospital's other departments and the emergency room. For example, there may be a patient who needs to be transferred to a particular ICU and there is a roadblock, like a bed availability is not there. So this issue would be resolved by the consultant by looking at alternate beds or speaking to the consultant and going about this. There may be a complaint coming from a patient or a patient's relative regarding a certain process in the emergency. So you'll have to sit down, understand what has happened, and give the explanation for such things. There may be medico-legal issues which are pending attention from a consultant. So this is how a daily life of a emergency physician would be involved in.
That was a very insightful answer with a lot of information about how a typical day looks like for you. Thank you, doctor. The next question which I have is, so how should I choose if emergency medicine is right for me or not?
See, this is not very difficult. If you recall your internship, a doctor's internship, when you worked under supervision in your medical college and you went through the different specialties, did you particularly like working in the acute care area? Now, acute care area means it can be the casualty of the medical college or when you were posted in other specialties like surgery, obstetrics, internal medicine, you were interested in those night shifts which were connected with the casualty or the emergency room. Did you like fast-paced work in the emergency? Then you would probably like emergency medicine. Did you do CPR on some patients? Did you treat septic shock? Did you treat burns? Did you treat poisoning? Did you like all these cases? If you have liked these cases, then you probably would like emergency medicine. So there are a lot of things like these which would hint that you like this specialty. So do you like saving lives very quickly? Then emergency medicine may be for you. If you like that patients must be admitted under you, they should stay with you for several days, you like to do surgeries, then emergency medicine is not for you. So these tests depend individually. So I would encourage that you meet one of the emergency medicine consultants, have a discussion with him, because each individual's likes and tastes change a little from each person to person. It varies. So it will take some time to uncover whether you really like emergency medicine or not. And the best way is to go meet an emergency physician who's been working for a long time in emergency and have a discussion with him and say what you like, what you don't like. Then probably we'll be able to say whether you would be the best person to work in emergency medicine and whether emergency medicine specialty would be the right specialty for you.
Thank you, doctor. Then the next question which I have is, what are the options available for someone who wants to pursue a career in emergency medicine?
Can you repeat the question, please?
Yeah, sure, doctor. What are the options available for someone who wants to pursue a career in emergency medicine?
See, I am assuming that you're asking what specialization or subspecialization is there after emergency medicine. In the United States and other developed countries, after emergency medicine's post-graduation, there are many subspecialties you can enter, like ultrasonography in emergency medicine. You can enter EMS, which is pre-hospital care territory. You can enter pediatric emergency medicine. You can enter geriatric emergency medicine. You can enter toxicology, which is a separate field. You can enter emergency department administration, which is separate. So like this, there are many specialties. If you just do a search for United States subspecialization programs, fellowships after emergency medicine board certification, then you have a lot of specialization which you can see. In India, all the subspecializations have not come in, have not matured yet. Emergency medicine itself is still growing. So subspecialization will happen as in the next few years. Few years means maybe in the next 3 to 4 years, these subspecializations will come in. One subspecialization which is already available right now is pediatric emergency medicine. There are at least 5 to 6 different institutes which have started pediatric emergency medicine fellowships, which a person who has completed his emergency medicine can join in, gain further experience, and work in pediatric emergency medicine departments. So pediatric emergency medicine is a separate branch from emergency medicine, from adult emergency medicine. So that is one of the career options which is available. There are many people who are moving into administrations because emergency physicians are very, very good in handling a lot of issues which are connected with all specialties. Their administrative skills are quite superior to any other specialist. So many of these doctors are moving into ED administration, which is emergency department administration. So like this, there are a lot of options which are available. So as you choose EM in the next few years, you will have these options opening up officially in the official channels.
Thank you. That was a very insightful option, whatever you've told for the students. The next question which I have is, what are the career prospects and how competitive or how promising is the job market after the training?
Emergency medicine job market is very, very good. If you look at all the hospitals which are there in India, or just look at the number of hospitals which are there in the major cities in India, not all of them have emergency physicians. Out of maybe 100 in each city, 100 hospitals in each city, you may have just 4 to 8 of them having qualified or trained emergency physicians there. The remaining are all open. There are usually just MBBS doctors sitting there or interns sitting there. There may be just nurses there. There may not be any emergency doctors there. Or there may be doctors who are not specialized in emergency medicine who are manning these departments. All this is scope for a trained and qualified emergency physician to work. So the job market and the job prospects are extremely huge. One of the best indicators are the salaries which the qualified emergency physicians are getting. And this is more than 3 times higher than other basic level specialties. So if a doctor finishes his internal medicine of surgery and there's a doctor with emergency medicine qualification, that doctor with emergency medicine qualification is getting 3 times more pay than the other two, because the other two will take time to build their patient clientele to become a little popular, because it's very competitive. Whereas in emergency medicine, the job market is very, very good. The doctors want qualified and trained people to work in their emergency departments. So the future of emergency medicine is very, very good in India.
Thank you, Doctor. The next question, which I'm just having a quick walkthrough through the chat, if there's been any question that has been posted. Participants, if you have any queries, you can post your queries on the chat box.
I can see one question here. There's a doctor who has asked, can you tell me about MEM that is conducted in some hospitals? See, MEM is known as Masters in Emergency Medicine. That is a 3-year training program which is started in collaboration with different institutes. Some of the institutes are based on foreign organizations like George Washington University. The one which is run within Indian organization is run by the Society for Emergency Medicine in India. And these are training programs which run for a total period of 36 months, because they remain equivalent to the MD and DNB program, because they are also 36 months. But note that these are not MCI recognized programs, but they do expose you into the world of emergency medicine. They do expose you to clinical care under a supervised environment within emergency medicine. So those of you are 100% sure that you want to enter into the career of emergency medicine can consider doing these programs. many doctors who are not sure of this, who think that a short duration experience would help them take the future decision, they all join the 1-year training program, including the Medvarsities. And 90% of them get convinced for a further career in emergency medicine, and then they continue on to do these programs. So that's what is MEM. Please note that these are not recognized by the Medical Council of India. There is a second question which is asking whether the DEM program by Medvarsity is recognized by Medical Council of India. The answer is again no. These are training programs. The training programs are quite good when they are done in association with foreign university, because you have a lot of inputs, including curriculum. Everything comes from the other countries which are considered as gold standards. So these programs are quite good, but they are not recognized by Medical Council of India. There's another question here. It says, I have completed my DEM from Medvarsity. Can I further continue my training for MRCM in India? So you will have to approach the head of department of the concerned hospital where the residency program is being run. You have to approach the head who's running the MRCM residency and apply there. So based on the interview, your past experience will be considered, and then you will be allowed into the MRCM program. Within Apollo hospitals, the diploma in emergency medicine 1 year, which is exactly 12 months of experience, you can use this as to exempt 1 year into the 2-year, 3-year residency program. But that entirely depends on verification of your training and your qualification during the interview process. There is a question here that says, is DM by Medvarsity a full-time course? Yes, it is a full-time course. It is not a part-time course. So you'll have to work in full-time shifts, which is 48 hours per week, as per any other employee within the hospital. So it is a full-time course. You will not be able to work in any other hospital or organization during this training period.
Participants, if there are any more queries, you can drop in the chat box. Or even in the Q&A section also.
There is a very short clarification I would like to make. One of the doctors has asked that he is not from India. So if you are not from India, then you need to have your Medical Council of India registration before you are taken into any of the residency programs within India. If you don't have your MCI registration for your MBBS, then you will not be able to manage patients in the emergency department. You can only observe if you will not be involved in patient care. So if you're not involved in patient care, you cannot complete a residency program. So it's important that you remember that you'll have to apply for MCI registration before you apply for any of the India's residency programs.
We have another question from someone called Akshay Parak. MCI recognized emergency medicine courses in which colleges?
See, there are approximately about 50 seats in the medical colleges related to MD emergency medicine. It's important that you look at the MCI's website. If you go to a MCI's website, you'll be able to search for these MCI recognized emergency medicine seats which are there in the colleges. Remember that there are two types. One is known as permitted seats, and the other is known as recognized seats. So ensure that you choose the colleges which have the recognized seats, because they are confirmed for MD emergency medicine for all the batches which are there. So try and look at these colleges, after which you'll have to attempt the appropriate entrance exams and then enter into MD emergency medicine, which will be of 3 years duration.
Thank you, Doctor. So just a quick wrap up. I have a last question here. So Medvarsity has been offering this diploma in emergency medicine for more than a decade now, and it's been quite a successful program with almost 3,000 plus students being trained so far, and an average of up to 300 students enrolling in the program for every year. And we've got RLA as our accreditation partners, and it has now expanded with up to 25 plus locations, centers across India, and even one location abroad. And our program has also been updated now with 12 modules theoretically, and like a parallel theoretical and internship training for the students. So, Doctor, you've been associated with this program from the very beginning. So, can you introduce the participants to this program and give them some more details of what this internship actually covers and what kind of training can they expect out of this internship?
Like I told, there are a lot of doctors who wish to learn emergency medicine for many reasons. One important fundamental requirement is that any doctor must be able to take care of emergency patients. It's not just take care, should be able to recognize that there is an emergency and stabilize the patient, take care of the patient, and then refer to whichever specialty it is necessary. So many doctors join this program, the Medvarsity's DM program, just to satisfy this requirement. And they are very, very good when they leave this program. So when you join us, we will ensure that the basics and intermediate skills of emergency medicine are taught during this 1 year period. It depends not only on us, it also depends on you, that you have the willingness to learn quickly the various skills of emergency medicine. We'll ensure that you are in a supervised environment, which means you can't do everything on your own. You will be watched. Based on your skill level, we'll allow you to do procedures. First, you will be observing, then you will be shown how it is done, then you will be doing it under intense supervision. You may be just assisting, and then if you are good and you are able to do it confidently, then you will be able to perform these procedures independently based on your skill level. You will be able to look at these patients, exercise your skills in reaching a diagnosis, order the appropriate investigations, get a diagnosis, begin a treatment, all within the supervised environment of another consultant who will be watching you. So this way you will not make any mistakes. The patient's safety is at very high level, and you will also get to learn these things. And we'll expose you to many other things like life support skills, disaster skills which are there. Then you'll be asked to go on ambulance calls so that you go on these ambulances and see what happens outside the hospital, in the field, what goes on, and you will be supervised there by the qualified paramedics who are present. Like this, you will get exposed to a lot of things within the emergency medicine department and the specialty. You will also follow up these patients into intensive care units to know what happens over the next 48 hours to 72 hours after a patient transits the emergency room. So this gives you a good insight of acute care. You will also learn a lot of team skills. You will learn a lot of communication skills, how to counsel people, how to talk to them when they are under extreme stress. So you'll be a very, very good doctor, but at the same time, you would have the skills of an emergency medicine physician. Now, these are sealed and stamped when you pass your exam. So when you pass your theory exam, you have proved that your knowledge is good. And when you pass the Viva and the practical assessment, you have proved that your skills are good. So, but you are still not at consultant level, because to become a consultant, you need further experience. And many of these DM doctors choose to train further into emergency medicine. And a few of them, they leave the training program because they want to practice immediately after that, whether in India or abroad. So that way, we have been creating a lot of good doctors. That's why this program has been running for such a long time, because these doctors are getting what they want. And that's why we are successful, and we have been continuously improving this program all these years in different areas.
Thank you, Doctor, for walking us through what kind of trainings the student can expect from this program. While we talk about that, we have another question from Ramya. Is there a significant difference between MD Emergency Medicine and MEM, both career-wise and learning?
Okay, so you will have to look at the environment of both these programs. There are a lot of differences here. There are a lot of similarities here. MD Emergency Medicine and MEM both are training programs for emergency medicine. End of the training program, both the doctors who were MBBS doctors would have skills and experience in emergency medicine. But there are a lot of differences here. MD Emergency Medicine is in medical colleges. The medical college hospitals are a different environment. The MEM programs are more in corporate hospital. Some of them are there in the medical colleges, but most of them are in the corporate hospitals, private hospitals. The environment of emergency in a private hospital, corporate hospital is different. I won't say one is superior to the other, but they are completely different. So it's important that you get what this difference is from people who work there. So if you want to choose between these two, I suggest you go meet an MD Emergency Medicine qualified doctor who has finished his training, and speak to him and get more inputs there, and speak to a person who has finished the MEM training and get more inputs from there. There is a clear difference that MD Emergency Medicine is recognized by the MCI and MEM is not recognized. It's not a postgraduate program. It's more of a training and certification program. So these are 3-year programs. So if you are still in doubt, I suggest you join the Medvarsity's 1-year diploma in emergency medicine, work in emergency medicine, get in touch with different people, and then take your decision whether you want to join MD or MEM in the future.
We've got another question from someone named Rita Bansal. What is PDCC?
PDCC is postgraduate diploma in cardiology, clinical cardiology. So there are some institutes which have PDCC, so you'll have to directly go. But I cannot give you any further details here because this is an emergency medicine webinar. So I'm not sure of PDCC here. Yeah. Any more questions? Is there any other countries recognize this DEM? See, this diploma is not recognized by medical councils of different countries. These are recognized by hospital groups. So I will not be able to tell you countries as such, but if you take your diploma certificate and apply in one of the Middle East countries, then that particular hospital will recognize that you are trained and certified in this field. They may not use it to change your designation to a specialist or a consultant, but they will place you higher than an MBBS doctor because you are undergone a structured training in emergency medicine. So that way your salary would be a little higher. You will get preferred over another candidate who's just MBBS. And clearly they will prefer you for giving you certain responsibilities within emergency medicine. Now, you look at it this way. If you have DM and you apply to my department, I immediately know that you are better than a fresh graduate of MBBS. I know that you have certain basic level skills. I know that you can resuscitate patients. I know that I can depend on you to take care, to assess patients, to call me when there is a very serious patient. So this way I can rank you above other doctors. So this kind of selection is there in many countries. I can't name them, but it depends on where you want to go. So you'll have to look at that. I have another question. What about MRCM? So what is your specific question on MRCM? MRCM is Membership of Royal College of Emergency Medicine. You can gain this when you pass 3 exams. MRCM Part A, Basic Sciences. You'll have to pass the Part B, which is the Theory in Emergency Medicine. And then you'll have to pass your practicals, and then you gain your MRCM. There are very good job opportunities. Again, MRCM fits the same way I told about the diploma program. When you apply in different hospitals, the hospitals will look at your background, where you have come from. If you have MRCM or any other training certification in emergency, which is well known, you will be taken for a job. You will be ranked above all the other doctors who would apply for the same position. MRCM MRCM is replaced by FRChem. See, these are two different things. There's a doctor who has asked whether MRCM is replaced by FRChem. There is no such thing like that. MRCM is a separate qualification. FRCM is a separate qualification. MRCM is membership, which you gain after approximately 3 years of training, whereas FRChem you will gain after approximately 8 years of training. That is, you will have to work in the United Kingdom to gain your FRChem. So these are two different things. You cannot confuse them. There is a question here which says, what is EMOC? I am not sure what is EMOC. I am not sure. Where did you hear this EMOC? I am not sure of EMOC. Maybe I will check up with my colleagues and I will probably let Medvarsity, Dr. Shravani know about it so that they can inform you on that.
Yeah, sure, Doctor. We'd be glad to assist the student offline later, maybe about what EMOC is.
Yeah.
Rita will reach back to you offline on what EMOC is. Thank you. And we take a final call to anyone wishing to ask any more questions about emergency medicine or DEM course. Thank you, Doctor, and thanks to all the participants. Thanks, everyone. Thank you all. Bye.